Are these asthma symptoms or just allergies? Imagine trying to breathe and feeling like your chest is being squeezed, or you hear a whistling sound when you breathe out. It can be confusing to tell if it's asthma or allergies. Both can cause similar symptoms but affect your body differently. Allergies happen when your immune system reacts to things like pollen, dust, or pet dander. They mainly cause sneezing, a runny or stuffy nose, itchy and watery eyes, and skin rashes. These symptoms usually come and go with exposure and tend to be seasonal or linked to specific triggers. Asthma is a long-term lung condition that causes inflammation and narrowing of your airways. When you have asthma, you might notice wheezing, which is a high-pitched whistling sound when you breathe. You could also feel shortness of breath, tightness in your chest, and a persistent cough. Unlike allergy symptoms, asthma symptoms can happen any time of the year and may be triggered by cold air, exercise, respiratory infections, or stress. These symptoms often last longer and can be more intense, sometimes leading to an asthma attack where breathing becomes very difficult. To tell them apart, remember that allergies mainly affect your nose and eyes, causing sneezing, congestion, and itchy eyes. Asthma affects your lungs, leading to wheezing, chest tightness, and trouble breathing. Allergy symptoms are usually short-lived and linked directly to exposure to allergens. Asthma symptoms can last longer and get worse if not treated. If you notice wheezing, persistent coughing, or chest tightness that keeps coming back or worsens, it's time to see a doctor. They can do tests to diagnose whether it's asthma or allergies. Sometimes people have both allergies and asthma at the same time. Allergens can trigger asthma attacks in people with allergic asthma, a subtype where inhaling allergens causes breathing problems. Recognizing symptoms like wheezing, chest tightness, and ongoing coughing is key to understanding what's going on. If these symptoms happen repeatedly or become severe, medical evaluation is necessary. Treatment might include inhalers to open your airways and reduce inflammation. Managing allergies with antihistamines or immunotherapy can also help prevent asthma symptoms caused by allergens. In summary, allergies mainly cause nasal and eye symptoms triggered by things like pollen or dust. Asthma involves airway inflammation that leads to wheezing and breathing difficulties. Spotting wheezing, shortness of breath, and chest tightness as signs of asthma helps you get the right diagnosis and treatment. Always seek medical advice if you're unsure or if symptoms worsen.